Hello, my name is Dr. Dewan as Raja. Today I will discuss about the pharmacology of the dobutamine. Dobutamine is a synthetic direct-acting catecholamine, a racemic mixture of positive and negative isomers. Positive isomers work mostly on the beta-1 receptor and it inhibits the alpha-1 receptor. The negative isomer work mostly on the alpha-1 receptor. Dobutamine is an inotropic agent and it increases cardiac output and decreases ventricular filling pressure. Dobutamine increases the adenylate cyclase and increases the force of contraction of myocardium. Therefore, it increases the stroke volume. We know that cardiac output is the multiplication of heart rate into stroke volume. Therefore, cardiac output will be increased. It is predominantly beta-1 agonist with little effect on beta-2 and alpha-1 receptor. It decreases end-diastolic volume, increases stroke volume, and systolic blood pressure. Dobutamine has no action on dopamine receptor. This is the difference between dobutamine and dopamine. So it does not increases the blood flow to the mesenteric vessel, does not increases the blood flow to the kidney, and it does not increases blood flow to the other internal organs. It has fewer vascular effect, little change in heart rate. Heart rate may be increased but not too much, and peripheral vascular resistance. Not too much peripheral vascular resistance. It does not significantly elevate oxygen demand of the myocardium. Yes, it may increase the oxygen demand very little, but that may be detrimental to a patient who has already cardiac disease like coronary artery disease. But it does not significantly elevate oxygen demands of the myocardium. It is not a bronchodilator. Dobutamine is administered intravenously because of its short half-life. Half-life is 2 minutes, which requires dose titration and desired effect. Dobutamine has multiple drug interaction. It interacts with other drug. So when prescribing other drug with that of dobutamine, the physician should have some precaution, like the drug beta blocker, carbidopa-levo. This is antihypertensive drug. Carbidopa-levodopa, anti-Parkinson drug. Tolcapone, again anti-Parkinson drug. Atomoxetine, dexmethylphenidate used in ADHD. So this drug will interact with dobutamine. So when prescribing this drug with dobutamine, physician should have precaution. Okay, therapeutic uses of dobutamine. It is used to manage congestive heart failure, cardiogenic shock, and other low cardiac output states. It has another therapeutic use is pharmacologic cardiac stress test. Some people cannot do physical exercise, cannot run in a treadmill, but they need cardiac stress test that is done by dobutamine. Dobutamine is used for a patient who can't exercise during the stress test. So by dobutamine, we can go through the stress test and we can assess the area of the myocardium which is defective. It can be checked by ultrasonography and also nuclear medicine technique. So what are the adverse effects of dobutamine? Headache, nausea, vomiting, chest pain. Especially if the person has already a existing cardiac disease, it will cause chest pain because Myocardial oxygen demand may be little increased. Okay, that may lead to chest pain, dyspnea, tachyarrhythmia, because the impulse can easily go from the SN node to AB node, especially in case of atrial fibrillation. So it as a whole causes tachyarrhythmia as an adverse effect. Caution in patient with atrial fibrillation because dobutamine increases impulse conduction through the AV node. Prolonged use of dobutamine may lead to tolerance. Okay, and that's all about the pharmacology of the dobutamine. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful and blessed day. Bye now.